My name is Heather Happy, and I am the staff licensed esthetician here at Cool Springs Plastic Surgery. I'm going to be performing a microneedling procedure on Emily. She's one of our nurse injectors for enlarged pores along the T-zone area, fine lines and wrinkles underneath her eyes, and also brown pigmented spots on her face. All right, forehead is typically the most uncomfortable. Might make you feel like you want to sneeze. Or send kind of a little electrical shocks up through the scalp. How does this feel?
It feels okay.
Okay. Hairline is typically the most uncomfortable. But Emily's been numbing for a little bit, so that helps with the discomfort. Part of the treatment is working on her nose. Typically, patients have lots of large pores on the nose, and the microneedling, due to the fact that it boosts your collagen, it actually helps to snap your elastin back into place, which can make the pore size a lot smaller. And if she has any areas that need extracting, then I can do that during the treatment as well.
Can't even feel the...
No, the nose really feels almost just like a vibration.
Yeah.
It just tickles more than anything. When I move under your eye, it's going to feel more like a feather tickling you. Now we're going to move underneath the eye. I'm going to make the needle length just a little bit longer to give you a little bit better of a treatment. This is really brilliant for working on the lines and wrinkles underneath the eyes where Botox and filler can't really help much without more of a surgical intervention. I've seen really great results by doing microneedling under the eyes. So this is going to feel kind of like a feather tickling. It shouldn't be uncomfortable. And I just get the microneedling device very close to the lash line. There's a plastic guard, so it prevents me from getting too close to the actual eye. And Emily's already starting to get pretty red. The goal of this treatment is to have moderate pinkness or redness of the skin. If a patient is too bloody, then the treatment has pretty much gone too far. We don't need to have a lot of bleeding to get a great result. So this will be as red as she will be, and then this is going to diminish throughout the day. She'll have just a little bit of increased redness kind of along this area, maybe a little bit on the nose, and that's just going to diminish over the next couple of days. This is also going to be a great treatment for you where you have your pink spots from leftover breakout. This is going to help to diminish those pink spots. You'll see an improvement with those almost immediately. Your brown spots will start to diminish as well. This is also going to be a great treatment for you where you have your pink spots from leftover breakout. This is going to help to diminish those pink spots. You'll see an improvement with those almost immediately. Your brown spots will start to diminish as well. So we have finished the forehead, nose, under eye area, and lip and chin. The redness on your forehead is already starting to go down. You'll still be a little bit red underneath the eyes, but I think you're going to rebound really quickly with the pinkness. So I'm at my deepest point with my needle length, so I can't really go any deeper. So what I can do is just adjust what I'm doing by going a little bit slower, and that's going to let the needles have more of an opportunity to make more channels in the skin. And then whenever I see an area that you have concerns about, like kind of the lines along the kind of corner here of your mouth or the pores, then I'll go a little bit slower over that area just to cause a little bit more of that wound that I'm looking for, but not, again, trying to draw blood. Just smearing it around to get it to go down into those little channels. These channels close up in about anywhere from 5 to 15 minutes. Just like whenever you have Botox or blood drawn, the little hole closes up. These needles are really small. They're smaller than what you would have done to draw blood or even to have Botox. They're a 32 gauge needle, so they're a very small needle. All right, and then your last pass will be with the hyaluronic acid. How does your skin feel? Does it feel tight anywhere or stinging?
Still pretty numb.
Good. So pretty much I think the forehead was the most uncomfortable for
Yeah.
you. Yeah. I do that part first just to get it out of the
Yes,
way. And then I don't
absolutely.
have to go back and fool with it again. And I think whenever we're done, I'm going to do a couple of extractions.
Okay.
Doing the microneedling helps to kind of break up the tissue a little bit, which will make the extractions a bit easier.
Perfect.
So I'll pop a couple of those little clog pores out for you.